Hey everyone, I keep forgetting to turn the photo before I turn the video on. So here we are, and it is 4 o'clock Central Daylight Time. So today I'm going to I'm going to do something interesting. I'm gonna share my bedroom with you all. Oh my God, you're looking around my house. So here's the thing to think about. I'm going to actually do some sit-ups on my bed. You know, most people talk about doing sit-ups on a hard floor, but I thought, here it is. You guys get to share my room, right? So I thought that I might lay down here on my bed. Oh, I have to move up because my feet come off the end. So, and there's my bad hair. So here's the thing that I want to do, right? I want to do some sit-ups on my bed. So, oh, look, you could put your hands here. Look, I can't do it both, right? But you could just do sit-ups and keep talking and here's bad. And keep talking. Hi, Karen. Talking. And there's some other people I haven't seen on there. Say hello. And you can just keep doing sit-ups. And how long can we do little crunches for? I don't know. Let's just keep going. And yeah, is it fun for you? Look at my hair sticks up with the static. So we just keep going. And, there's a point where we go, I can't do this anymore. Well, I could keep going. But, one of the things that I want to think about in terms of today is I was doing a peer-to-peer or a peer support for peer workers call earlier. And one of the things that people were talking about on the phone, I might set up, right? This is a bit weird. I might take you, just sit up in here. But one of the things that a number of people were talking about on that call is that they're tired. And so one of the things as peer workers that we have to consider is how do we make sure that we take care of ourselves in this environment? So we're all most of us got into this field because we want to support people, right? We want to see people have the most amazing lives possible. And right now, we're not just talking about the people that we would normally support, but we're talking about the community, and how do we actually support them as well? And I think, and I keep talking about it, and it keeps coming up, right? Is that we have this gift of our resilience to be able to share with the community, of the ways that we get through it. And, I've talked about Mind's humour. I've heard other people talk about self-care, in terms of mindfulness, or some people meditate, some people take a walk outside, some people eat healthy, some people might binge watch a TV show. I've done that recently. I must admit, there was one day I just went, I don't want to work. And, it was a weekend, so it was fair enough. But I watched Outlander. Yes. But it is that place about really thinking about what are we doing for our self-care. Because the place is that, we actually get to save ourselves first. Because if we don't save ourselves first, we're not actually going to be used for anyone else. So, part of the silliness of doing sit-ups on my bed today, because we can do sit-ups, right, and crunches and things like that, is that we actually get to slow down sometimes and just do that. And, I was seeing over the last couple of days a friend of mine in Australia who I think I talked about on the session yesterday, is was one of the commissioners of the New South Wales Mental Health Commission, is saying the same thing in Australia that I am. Why aren't we utilising peer support across this country, across the world, to support people, because the resilience factors that have got us through this, like, are things that we can tap into. The resilience factors of anyone with a mental health issue at the moment, like the fact that people are here, they've been utilising skills to hang around. And I encourage us to talk to anyone, even if the providers think they're vulnerable people, and ask them to, like, stand up and support others, because sometimes when we treat people as valuable and assets, they will do that. So, you know, I like the setups here are kind of things. I love setups. I know, am I weird? But I really like them. But it's about finding those things daily. So I have started exercising a little more. So I have started doing things like a little bit of Pilates, a little bit of yoga, some weights, and I am using cans, and I will use them again, and things like that. But I really want us to start, like, to engage people differently, to engage with people when we're walking down the streets. And now you're walking down my hallway, but it is the place that we can, like, engage in different conversations. Say, hi, how are you? And actually really care about what's happening. Just do those simple things. Like last night I had a conversation with people outside my apartment for like an hour. They were sitting on their deck, like having a drink. I don't know what they were drinking, but something. And we were just chatting about the current state of things and things that we're all doing to get through this. And it's about staying connected. It's about sharing with each other and talking through that. So I see New Zealand's on my call today. How about that? What? So I just want to say thank you. I've done my 5 minutes. I hope you come back tomorrow. And I have to start thinking about like other things as well. So if you've got any suggestions about home silly exercises that can keep us happy, do that. I see Karen talking about walking around the house twice every hour. That's something to keep us going, right, exercise-wise, but also take care of your mind through this. So thanks for being part of this. Love you all and see you tomorrow. Okay, bye.